In this video, we're going to talk about two modules, the nurse and the doctor's module. Previously, we talked about the reception module and how the receptionist is able to create patient record, booking of appointment, alongside other functionality. So the dashboard are similar across boards. For the nurse, we get our basic statistics of pending vitals, medications due, pending admission, and pending surgery. So there are also quick action buttons to easily access the vital page, admission page, surgery, and medication page. So I'll quickly go over to the vitals page so I can record the patient vitals. So there's something you need to note. On all of the tables, there's a contents menu. And to access it, you just need to right click on whatever record you're trying to access, and you will see the actions that are available to that record. So we're going to go ahead to record the vitals. And before we proceed any further, I would like to state that all the patient information displayed in this video are for demo purposes and are not of real patient. So I'm going to select the vital form. There might be more than one, so depending on what the hospital wants. So I'm going to continue and I'm going to fill in this form to record the patient vital. And the beauty about this form is it's able to tell you if your value is high or if the value recorded is low. So beneath this input box, you can see the normal range 60 to 90. So if I should put a number of 2, it's going to tell me it's below, and if I should put 200, it's going to tell me it's above. So I'm going to quickly fill in this record, and I would purposefully increase some numbers so we can see how the indicator works for high values. And mind you, there are some input that are auto-calculated, like the BSA, the BMI. So I'm going to go ahead to save the vital records. And as you can see, we get the vital stats. And temperature is high, of course, 43 degrees high. Then pulse pressure is low. You can see that body mass is high. Then body surface, BSA, it's normal, blood pressure, normal respiration. So those are the indication, and also you get a timeline that displays all of that as well. So whatever is the patient, it is recorded in the timeline. Alright, so this is for the nurse. Like I said, we'll be looking at both the nurse and the doctor's module. So we'll be doing a little bit of back and forth. So over to the doctor's dashboard, of course, an overview of pending appointment, cancelled appointment, and when you click on the start, it will take you to the page. So for pending appointment, if I should click on the start, it takes me to this appointment. So we have appointment for Temitokwe, and I can go ahead and right click trying to access the context menu we talked about not very long ago. So when I right click on the record, I see the option to start consultation. So I'm going to click on that to actually start the consultation. So as a doctor, I'm able to see the vitals that were recorded, and I can decide to take another vital record, if I want to. For this video, I'm going to skip that. So you can see that the timeline also updated to show when the consultation was started. So doctor is able to diagnose this patient, and that is easy when it just navigates to the diagnose tab. There's a note tab. The doctor can decide to create a note for the patient. Then for diagnosis, if he clicks on the button, he's able to search for any diseases. I can say HIV. And I can select that. I can select multiple diagnoses, and when I'm done, I can just go ahead to save them. Alright, so diagnosis has been saved. and as you can see, the timeline updated to show us that diagnosis was recorded for this patient. Then for investigation, the doctor is able to request for tests. So I'm going to request for a few tests which we would see in other modules like the lab and radiology. So I'm going to go ahead and click on the complete blood count test, and I'm going to search for chest X-ray. There it is, or rather CT scan, and I'm going to request for this test. So in another video, we're going to see how to record this test and how the doctor is going to receive the results. So I can as well prescribe drugs, add prescription, then search for whatever drugs I want to prescribe depending on what is available in the shop. Alright, so I'm going to select this, and the dosage step, I'm going to say it's tablets, and for the dosage I can just say maybe 2 tablets. I'm going to click on this dosage suggestion. I'm going to say 2 tablets. The frequency is going to be once daily for 7 days, and this is going to automatically calculate the numbers of tablets the patient is going to collect. So route of administration, I'm going to say oral, and then I'm going to add. So I can add as many prescription as I want, but for this video I'm just going to add one. So I'm going to create prescription. Prescription has been created, and as you can see, it has been documented on the timeline. So I'm going to go over to admission. I can request admission for this patient. So I'm going to select the admission type. This can be set by the admin. So I'm going to request admission. And now admission has been requested. So you can see the admission details. And mind you, all of these requests can be cancelled. So I can decide to delete this request. Same for prescription, investigation, and even diagnosis. And so now I have requested for admission. As a doctor, I can head over to the admission page and then admit this patient. But I can also do that for the nurse. So it is the same flow, it is the same functionality. So if I come here and I right click, I'm able to see admit patient. So I'm going to see number of available ward, and currently bed 823 is not available, which is why it is disabled, but 822 is available. As you can see, it has been selected, so I'm going to go ahead to admit patient. Alright, so now patient has been admitted. So over to the doctor's module. I'm going to view patient record. Alright, so you can see that the timeline shows when the patient is admitted and by who the patient was admitted. So I can also request for surgery for this patient. So I just click on the request surgery button, and then I'm going to select the available surgery. I can search, and then of course I can as well just scroll, and when I see the right surgery I can pick that, and I'll select the surgeons that are available. I'm going to select Dr. Ayo and Kesena. Alright, so urgency level is optional, so I'm going to leave it, and I'm going to place the request for this surgery. So similar to admission, so we're going to now schedule the surgery. Right now the surgery was booked, but it has not been scheduled. Alright, so we have case notes. After surgery we have case notes. So maybe if the patient returns after a while, maybe a week, a month, so these are the records that help you understand whatever issues the patient might had in the past. Just documentation about all the activities and all the tests that have been done for the patient. So this can also be printed. Right, so this can, of course, you can preview it and you can print it to your computer. All right, so the reception module, we talked about opening patient documentation, the patient file, maybe from a previous hospital. So whatever document you upload, you're able to access it under the patient folder. Then there's a beautiful function that Tech Health has. When you click on a template, you don't always have to type. So you see a microphone icon, you can just click on it, and whatever you're saying is being converted to text. So as you can see, what I'm saying right now is being converted to text. So when you're done talking, you can just click on the icon to stop recording. And that's it. So back to the nurse. We made a surgery request. Although there's a separate module for surgery, and that also covers what we're about to talk about. So mind you, like I said, the doctor and the nurse both share some of the functionalities as it concerns the patient. So the nurse can as well schedule the surgery, but so can the doctor. So on either side, it is the same flow, it is the same process. So I'll go ahead to right click. Remember we talked about the context menu. So go ahead to right click. So right now there is no available operating room, which is why this is grayed out. So I'm going to pause this video, quickly create one, and then we'll resume. Alright, so I've been able to create an available slot. So now when we navigate back to the schedule surgery modal, I am able to now select available operating room. So we have slot 7 available. Alright, so I'm going to go ahead and pick surgery dates, and I'm going to pick the end date as well. Alright, so I'm going to go ahead to schedule the surgery. Alright, so surgery has been scheduled. And now if I should right click trying to access the context menu, and I get option to record theater log and perform pre-op nursing. So once I click on that, I'm able to fill out the necessary input for the pre-op checklist. So I'm going to quickly do that, and so we can see how that. If you notice, there's this red star. That's an indication that those inputs are required, so you can't skip them. But for every other input that does not have them, it means they are optional, so we're going to skip them. So I'm going to save the pre-op assessment. That has been updated, and now if I should view theater log and scroll down and navigate to the pre-op operative, I'm able to see all of this data that I recorded for the patient. So I'm also able to record theater log and also post-op. So I'm going to quickly do that as well. So I'm going to select patient entry time. Alright, so I'm going to save. Alright, so this has been updated. I can as well edit to say the surgery is now completed. Okay. Yeah, so this tells me that surgery is completed, and now we can perform post-op. So I can click on the record button, and then it gives me the form asking for the patient exit time from the surgery. So I can also select that. Then arrival time to the recovery room. Okay, so pain level, basically just form filling. And so when I'm done filling what is required to be filled, then we can decide to transfer the patient to a different room. So all we just need to do is click on the transfer button, and currently there's no available ward or available room, but if there was, then we just pick one and then transfer the patient. But if the patient is okay to go back to their previous room, then we're just going to leave it at default and save the post-op. So now we have successfully completed. By the time you say post-op, it means you've completed the surgery. So if I should go back to the surgery page, surgery now has a status of completed because we are done with surgery. And like I said, this can be performed both on the doctor's module and on the surgery module. Alright, so the nurse are able to perform administer medications. And so if I should click on manage, I'm able to see the drugs, the time I'm supposed to administer them. So it's just a click of a button. The time is auto-registered. So depending on the time the nurse is actually giving the patient, so that will be auto-filled. Then whatever notes the nurse wants to add to the administered medication, they can do that as well, and then confirm administration. So if you scroll down, there's also a drug chart. So you're able to tell, okay, there's drug due by 2 p.m. and there is another by 8 p.m. So that's for the medication page. And so far we've talked about the vitals page, the nurse taking vital records. Then also we've talked about the admission. So if I go to admitted today, we should be able to see the patient that we admitted today. So this patient is currently admitted. Then for surgery, we completed one surgery today, so we can also see the record for that. So that will be it for this demo video. Subsequently, we're going to update this content to better show and explain these modules better. Thank you for watching. Bye.